Here's a phenomenon that perfectly illustrates how easy it is to confuse correlation with causation if you're not paying attention to broader context. During the pandemic, there was massive disruption to routine healthcare, including cancer screenings. Then, as society reopened and vaccine campaigns rolled out, there was a surge in cancer diagnoses. The timing created perfect conditions for people to draw a false connection between vaccines and cancer, when the actual cause was something entirely different: delayed detection. Let me walk you through what happened. During COVID lockdowns, routine cancer screenings like mammograms, colonoscopies, and dermatology appointments were postponed. People avoided healthcare facilities out of fear of COVID exposure. Medical resources were diverted to pandemic response. Elective procedures were canceled. This created an enormous backlog of undetected cancers that were growing silently in people's bodies. When healthcare services resumed and people returned for delayed screenings, there was a predictable surge in diagnoses. But here's the crucial point. These weren't new cancers caused by something in 2022 or 2023. These were existing cancers that should have been detected in 2020 or 2021, now being found at later, more advanced stages because of the detection delay. The vaccine rollout happened to coincide with this return to normal healthcare utilization. So you had two completely independent phenomena occurring simultaneously: mass vaccination and a backlog of cancer diagnoses from delayed screening. The temporal correlation was purely coincidental, yet it created the perfect storm for misinformation. Epidemiologists call this surveillance bias. When a population receives more medical attention, more testing, more imaging, previously hidden conditions get diagnosed. But the underlying disease rate hasn't actually changed, only the detection rate has. During COVID, we saw the reverse. Reduced surveillance leading to reduced diagnoses, even though cancer incidence remains stable. There's also something called lead time bias at work here. When you diagnose a disease earlier, it appears more frequent even though the actual occurrence rate hasn't changed. The screening resumption made it seem like more cancer was happening when really we were just catching up on detection that should have occurred earlier. The imaging done for COVID-related concerns also led to incidental findings. When someone got a chest CT scan because of COVID pneumonia, radiologists sometimes spotted lung nodules that had nothing to do with COVID or recent vaccination but that now required follow-up. This detection paradox reveals how critical it is to understand healthcare system dynamics when interpreting disease trends. You cannot just look at when diagnoses happened, you need to understand what was happening with screening and detection capacity during that period. Here's the tragedy. Some people whose cancers would have been caught at early, highly treatable stages during routine 2020 to 2021 screenings instead had their cancers detected at advanced stages in 2022 to 2023 after the delay. Some of these delayed diagnoses likely resulted in worse outcomes and possibly preventable deaths. But when people misattribute these cases to vaccines, it diverts attention from the actual problem, which was healthcare disruption during the pandemic, and prevents us from learning the real lessons about maintaining screening continuity during public health emergencies. Understanding this requires stepping back and looking at the bigger picture, not just individual cases and their proximity to vaccination, but the entire healthcare landscape and how disruptions to normal care create downstream effects that show up months or years later.